Hey everyone and welcome back to the channel. So if you are experiencing chest pain, it can be scary and unsettling. And your initial thought might be, am I having a heart attack? But not every case requires an emergency room visit. While it's important to always be cautious and seek immediate medical attention for severe or unexplained chest pain, there are times when you can manage discomfort safely from your home. So in today's video, we are diving into simple yet effective home remedies and lifestyle changes that can help alleviate the mild chest pain, especially when caused by non-life threatening issues like muscle strain, acid reflux, or anxiety. So let's get started and also explore the practical tips to relieve discomfort and breathe a little easier. So how do you know if your chest pain is serious? It is one of the most common reasons people go to the emergency room. Most of the time, the cause isn't due to heart attack or other life-threatening condition. So when you should worry about your chest pain. So the chest pain might be serious and require emergency care if it feels like pressure or tightness, if it starts suddenly and doesn't go away, and if it occurs symptoms like shortness of breath, lightheadedness, fatigue, nausea, and sweating. So, how to get rid of chest pain at a home? So, if your healthcare provider ruled out heart attack and you are still having chest pain, you can try treating at home. Also, checking in with your primary care provider, even if your symptoms are mild. They can determine the cause of chest pain and help you guide your care. So, let's look at antacids for gastrointestinal related pain. It is one of the due to something you ate or drank. It can feel like heartburn or a heart attack. You may experience this chest pain when swallowing or mainly after these four reasons. First is drinking alcohol or carbonated beverages. Second is eating rich or spicy foods. Third is lying down after eating. And fourth is taking pills. If your chest pain is associated with food, try an antacid medication. Tracking what you eat can also help you identify your triggers, so you can eliminate those items from your diet. Eating more fruits and vegetables, whole grains, and fermented foods can also improve your gut health naturally. If you feel the pain is due to food getting stuck in your chest, the cause could be an esophageal mobility disorder. Your esophagus opens and closes to move food from your mouth to your stomach. If your esophageal muscles don't work properly, food may get stuck. It's important to see your healthcare provider so they can diagnose and treat this condition. Second is use an inhaler for lung related chest pain. At home, strategies to address lung related chest pain are limited. If you have asthma, try your inhaler. Other lung conditions that cause chest pain should prompt a call to a provider. This is true especially if you are having other symptoms like coughing or wheezing, fever, shortness of breath. Some people complain of chest pain from vaping. Vaping can cause lung disease, and quitting vaping isn't easy, I know, but it's the best thing you can do for your body and your health. So let's look at some anti-inflammatory meds for musculoskeletal related chest pain. You typically feel musculoskeletal chest pain in a specific area. The pain likely gets worse when you press on it and take a deep breath. If this is the case, the best home treatment is rest, ice, and inflammatory medications. In patients with a known history of coronary artery disease, aspirin is a main medicine strategy used to reduce the risk of heart attack. If you known history of a heart disease and are having symptoms that you are concerned may be a heart attack, the most crucial step is to call emergency service so they can respond in a timely manner. Taking a full dose of aspirin while waiting may help to reduce the risk of heart damage as well. Now let's look at herbs, foods and other supplements. Often heartburn is due to imbalance of the acid levels in stomach lining. So baking soda mixed with warm water or low fat milk can sometimes help neutralize the acid and resolve symptoms. How to get rid of anxiety related chest pain? A panic attack is easy to confuse with a heart attack. Both cause sudden chest symptoms and swelling. The main difference is type of chest pain you feel. Panic attacks usually causes sharp pain, and heart attacks are more likely a heavy pressure on your chest. If you never had anxiety or panic attack before, call your healthcare provider. Anxiety is usually psychological, but it can also be caused by a physical condition, including a heart attack. When having a heart attack, women tend to present at the ER later than the men. This can be because they are more likely to attribute their chest pain to anxiety or other conditions. If panic is causing your chest pain, try these strategies to help stop a panic attack. First is you need to acknowledge that it's happening and will pass. Second is breathe deep, then distract yourself. And fourth is track when your symptoms occur to identify triggers. Getting help for panic attacks is essential for your health and wellness. Therapy, medications, and other treatments can not only help get rid of chest pain, but they can also help you get most of your life. So, in any scenario, emotional stress can play a significant role. So, if at any point you are concerned about your safety or you are experiencing these symptoms for the very first time, treating the situation as it's an emergency may be an important part of treating your condition. At the end of the day, there are multitude of possible conditions that can cause the chest pain. I therefore urge all the patients to ensure that they are seeking medical attention as quickly as possible for new symptoms so we can make a diagnosis and get them on the right treatment path as quickly as possible. I hope you found these tips helpful for managing mild chest pain at home. Remember, while these strategies can be effective for certain types of pain, never ignore severe or persistent chest discomfort. Always consult your healthcare professional to rule out any serious conditions. If you enjoyed this video or learned something new, don't forget to give it a thumbs up, share it with others who may benefit from this, and subscribe to our channel for more health and wellness advice. So take care of yourself and until next time, stay healthy, stay safe, and we will see you in the next video. Thank you.